Sexual assault against children, the Protection of Children from Sexual Offences Act 2012. An act to protect children from offences of sexual assault, sexual harassment, and pornography, and provide for the establishment of special court for trial of such offences and for matters connected therewith or incidental thereto. The Protection of Child from Sexual Offences Act 2012 defines a child as any person below the age of 18 years and provides protection of all to all children under the age of the 18 years from the offence of sexual assault, sexual harassment, and pornography. This offence have been clearly defined for the first time in law. The Act provides for a stringent punishment which have been guarded as per the gravity of the offence. The punishment range from simple to rigorous imprisonment of various period. There is always provision for fine which is to be decided by the court. Section 3 of the Act defines penetrative sexual assault as a person is said to commit penetrative sexual assault if he penetrates his penis to any extent into the vagina, mouth, urethra, or anus of a child to makes the child to do so with him or any other person, or he insert to any extent an object or any part of the body not being the penis into the vagina, urethra, or anus of a child and makes the child to do so with him or any other person also. He manipulate any part of the body of the child so as to cause penetration into the vagina, urethra, and anus, or any part of the body of the child and makes the child to do so with him or any other person, or he applies his mouth to the penis, vagina, urethra of the child, or makes the child to so much to such person or any other person. Reporting of the case under this Act, Section 19(1), notwithstanding anything contained in the Bharatiya Narik Suraksha Sanhita 1970, any person including the child who has apprehension that an offence under this Act is likely to committed or has knowledge that such offence has been committed, he shall prove such information to Special Juvenile Police Unit or local police. Section 27 deals with the medical examination of such cases and states. Medical examination of a child in respect of whom any offence has been committed under this Act. Notwithstanding that a FIR or complaint has not registered for the offence under this Act, to be conducted in accordance with the Section 164A of CRPC 97. Yes, the victim is a girl child. The medical exam shall be conducted by a woman doctor. Medical examination shall be conducted in the presence of a parent of the child or any other person to whom the child reposes trust or confidence. Where in case the parent of the child or any other person referred to his subsection cannot be present for any reason, during the medical examination of the child, the medical examination shall be conducted by a person or woman nominated by the head of the medical institution. Medical care is usually provided by a doctor and a sexual assault nurse examiner. Sane in a hospital, sexual assault nurse examiner is sane in a hospital emergency department or medical clinic. Evidence collections may occur up to 124 hours from the assault and occurs with the consent of the patient. A sexual assault examiner is a specially trained professional who will provide needed care, documents the details of the assault, and collect evidence. The professional can recommend a treatment for sexually transmitted infections and pregnancy prevention if needed. In addition, she is available to testify in the court. Reporting sexual assault to the police. Only 16 to 18, 38% of the rape acting report to law enforcement. Only 17 to 43% for medical evaluation after rape. 1/3 of rape never report to the assault to the primary care doctor. It is recommended that all victims should seek a medical evaluation. Best chance for collecting accurate information and evidence is within first 24 hours of the sexual assault. Although many states allow evidence to collected up to 7 days later, changing clothes, showering or bathing, eating, douching, going to bathroom, brushing hair or teeth should be delayed until evidence is collected is possible. Preventive treatment. There is a small risk of becoming infected or pregnant as a result of sexual assault. Risk that a woman will become infected with HIV after a single episode of a consensual vaginal intercourse, not sexually assaulted, with an HIV infected person is estimated to 0.1%. From a single episode of consensual risk of developing HIV from a sexual assault may be higher, especially if the skin is torn or cut, if there is bleeding, or if there are multiple asylum. Central for Disease Control Prevention, CDC, Central for Disease Control and Prevention, and other expert group recommend preventive treatment if mouth, vagina, or anus and non-intact skin for a cut is exposed to assailant's blood or body fluid. Follow-up and care. Most experts recommended for a follow-up visit with a healthcare provider within 2 weeks of the assault. Testing for pregnancy, gonorrhea, chlamydia trachomatis, bacterial vaginosis is recommended after the assault. Testing for HIV is usually repeated at 6 weeks, 3 months, and 6 months after the assault. The schedule of testing is recommended because in some cases it takes up to 6 months for the blood test to become positive. Counseling and psychotherapy. Counseling or psychotherapy can be helpful in dealing with the events of assault cases itself, as well as anger, fear, depression, or anxiety that many people feel afterward. Several types of health provide counseling, including social workers, psychologists, nurses, and psychiatrists. Some people prefer to meet one-to-one with a counselor, with others prefer to meet in a group setting with other people who have had similar experience. Recently, 2014, Ministry of Health and Family Welfare, Government of India, issued a comprehensive guidelines and examination performed for the medical exam sexual assault. While incorporating most of the above mentioned recommendations in preparing the protocol and guidelines, committee deliberated various issues and took cognizance of the lack of uniform protocol and gap in existing professional medical legal care to sexual violences. The recommendation of the Justice Verma Committee, the Criminal Law Amendment Act 2013, Protection of Children from Sexual Offences Act 2000, while doing so, an international standard, especially the WHO guidelines on medical care and a clinical and a policy guidelines for responding to intimate partner violence and sexual assault were referred to. Besides the general guidelines of the victim of rape and sexual violence, the document also highlighting the issues concerning the transgender and intersex person as well as the person with a disability who have given detailed guidelines in the examination such an a victim. These guidelines for health workers are aimed to provide an appropriate understanding the sexual violence needs for the right of survivors of victims of sexual violence, medical and forensic responsibility of health prevention detail. Okay, thank you.